there are several driving factors attributed to unintended pregnancies, which have been associated with either low contraceptive uptake or the lack of access to contraceptives by young women and girls across the country. The Health Systems Research Unit, a division of the South African Medical Research Council, the SAMRC, investigated the persisting and alarming barriers to contraceptives, both use and access. So we are going to be joined by Dr. Kim Jonas, who is one of the scientists at the forefront of the research study. For more, a very good afternoon to Dr. Kim. Thank you for your time with us here on the SABC.
Good morning. Sorry, good afternoon.
It's all right. Perhaps at this point, as the world observes World Contraception Day, you could speak to the importance of it in a post-COVID-19 era.
Thank you. So World Contraception Day is a very important day because it raises awareness about the different types of contraceptives and the benefits of using them, particularly among young women and girls, which is the primary purpose to prevent unintended pregnancies. And we know in the country that we've got a problem with unintended pregnancies, particularly among adolescent girls in the schools.
Thank you for that context. Absolutely. And then at this point, what are the challenges in South Africa, in a unique South African context, when it comes to sexual and reproduction health rights services in the context of contraception for both young women and girls?
In our country, from our research, we found that the young girls don't really know much about the different types of contraceptions that are available to them, and also don't have enough information as to how to use them or what to expect when they're using them. At the same time, they also have a lot of myths and misinformation about the contraceptives from the community and their peers, which continue to deter them from using contraception. For example, in our study, we find that young women and girls do not want to use contraception because, with a specific reference to the injection, they say it makes their body big and it makes them look fat and change their body in an unpleasant way. At the same time, they don't use contraception because their partners are not supportive of the contraceptive use due to the same myths and miscommunication that are related to long-term infertility as they hear from their peers and other community norms in the community. In a sense that if you use contraception while you are still a young girl, you will not be able to have children in the future. So all of these norms affect the uptake of contraception among young girls in our country. And that also the parents don't support the use of contraception because it is seen as a way that it encourages sexual activity. Yeah.
At the forefront of research around this topic, what are some of the key findings of the research conducted that revealed the barriers in accessing contraceptions? What's the role of myths and contraception around contraceptions as well?
The main myths and misconception around contraception is the fact that some of them, they don't work, and some of them, they have long-term consequences such as infertility, and some make the sexual drive a bit low, or they decrease the libido. Other research findings that we have from our studies also show that they really don't have enough information and they have poor access to the health services, our traditional clinics. Young women and girls don't want to go to the clinics because they fear being seen at the clinic. They also fear the judgment and the attitudes of the nurse. We've known this for a while now, that young girls feel very threatened and very afraid to go to the clinic because the nurses are not treating them friendly, are not welcoming them in a friendly way. Yeah.
Thank you for that, Dr. Jonas, because at this point, I wonder what the impact of low uptake and lack of access to contraceptives amongst young women and girls in the context of unintended pregnancies and teenage pregnancies has amounted to in South Africa.
Well, low uptake of contraception really just leads to unintended pregnancies and increase in teenage pregnancies as well, because the young girls in the schools are not taking contraception as they used to. From our research, we find that only about 37% that were using contraceptives were in the past 6 months prior to our survey. And many of those, they're not using them consistently and sufficiently, correctly when they're having sex. For example, at their last sex, only about 11% that use contraceptives effectively every time when they're having sex, as well as with the condom, that is dual contraception to prevent both unintended pregnancy as well as HIV.
Dr. Jonas, thank you for your time.
Um,
do continue as you complete that point.
I was going to say that other factors that lead to low use of contraception is in relation to access to services. If you don't take contraception, obviously young women, girls are not preventing themselves or do not have the rights to plan their pregnancies and place their children, especially those who are in stable relationships. They don't have a right and the power to say that they're not ready for the children because they're not using contraception, as we know that they have a high unmet need for contraception in the country. They want to prevent pregnancy, but they don't have the right and the space and the platform to access the contraception services because there are lots of all these other barriers for them to accessing contraceptions in our communities and in our clinics.
Dr. Kim Jonas, thank you for your time with us on the SABC and for those sentiments as we observe World Contraception Day.